Medical Dilemma.
Welcome back to Medical Dilemma. Again, we'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation. Now, we continue with our discussion for the third segment. And this time, let's ask Dr. Contejos, whenever you operate on the thyroid, I guess the cut would be somewhere at the base of the neck.
Yes.
Okay. And so, would that cause any kind of visible scarring or marks?
Yeah,
that would
of course, when you cut, then you have scar. But in the older patient, usually the scar is less prominent.
Less prominent.
But in the
When
younger
you say
person,
older, is how old?
when you say older, it's around 50 and above.
Less prominent.
When less prominent.
Uh-huh.
When they are young, like 20 years old, 30, they can tend to be more prominent because you know the elasticity of the skin. Well, there are some things that we do to lessen the scar formation, and some of these are ointments which we put after surgery. Okay. Of course, there are now lately developed new approaches to surgery. Like we have started this some 5 years back, just very small holes, very small incision, and we call it the MIVAT, minimally invasive video-assisted thyroidectomy, where we just approach it. We just have a 2.5 centimeter incision here, and then we use endoscopes to guide us through the thyroid and remove it. That's one. The other approach, which is very popular in Vietnam now, is what you call the transaxillary. So transaxillary thyroidectomy, meaning they have small holes here.
Dito sa ating kilikili,
Yes, in the
armpit.
axilla and also underneath the breast. And then they have scopes and they approach it there.
Is it is supposed to be minimally
Yeah, it's
invasive,
minimally
but
invasive.
is it not
But you have to
traumatic
go through
also just to
longer
go
one
that
reason,
long way?
I was able to observe in Vietnam, and for one reason, that is the preferred approach of the patients in that area.
So that there's no scar.
No scar at
Are
all.
they less risky, doctor?
Is it
Well,
yeah,
you need to have a special training to do it.
and
The moment-
special
the moment
machines,
that,
apparatuses.
and the moment you're able to do this, you know, well, it's what's getting popular now everywhere is actually the minimally invasive approaches like the laparoscopies, even treatment for gallbladder, cholecystectomy, and laparoscopic approaches. So same is true with us. We're getting into that too. So if it is done properly and the surgeon is trained properly, then the complications are also less.
less
How would an ordinary person know if a surgeon is trained properly?
credentials. Yeah.
Good question.
Right.
Good question. Normally, you have what you call a diploma. You are called a diplomate,
Yes.
Right.
diplomate of a certain specialty. But of course, for the new techniques and the new approaches, this is not yet covered by the diplomate title, you know. So you really have to, well, you have to talk to your doctor. Sometimes I have patients who come to me and says, "Doctor, how many operations have you done already?"
this?
And you have to be honest with them and
Right,
say,
right.
"I've done this much." Yeah.
And probably that only shows that there are no accrediting agencies here yet.
We
as far
have.
as this,
We have,
Okay.
but
Yeah,
not
they
not
have,
not
but
for
not
not
for
for the special skilled operations
okay.
like
Yeah, like that.
Okay.
minimally invasive and transaxillary approaches. Not yet. Yeah.
I suppose the cost should be lower because it's just a small thing.
Yeah, but the
scar
instruments
somewhere.
are
Or is it
the
more
instruments are
very expensive.
very expensive. You have what you
Uh-huh.
call the special harmonic scalpel thing. You have
So they have to pay for the
a lot of
ano,
video setups and everything.
But
So
which
that's
is
what you pay
shorter,
for.
the procedure.
If the surgeon is very skilled, it's faster actually.
Than the ordinary thyroid.
Well, it's almost the same actually. Almost the same, but you know, you still have to close, see, the regular incision. But the small ones with small holes,
Oh.
then just one nut, you know, one
nut.
suture, and that's it.
I
And
see.
I suppose that the ones who are not yet so skilled will have also lesser professional fees, something like that. Which are
So one can actually judge
not
the skill
necessarily.
not,
based on the fee.
You know,
The same rate?
professionals professional fees, I think, is something personal to the
Uh-huh.
doctor.
Yes.
Of course, we set standards, but there are some
The
doctors.
society, does the
Yes,
society set
we do set
standards?
some standards also.
Okay.
But there are some doctors who tend to bill less. There are some doctors who tend to bill more. See?
Well,
So
actually,
bahala
there
na
is,
sa patient.
there is some ethical issue there because, well,
Yes.
if you undercut, then a lot of people will go to you. If
Yeah,
you,
yeah, that's right.
if you, charge more excessively, probably less. But the
Yeah.
ones who will go to you are the moneyed ones,
The- the
something.
richer
So
yeah.
there is an ethical decision. That is why there are also issues as far as professional fees are concerned.
Mhm.
And they say that, well, it should be, professional fee must be such that a doctor must be able to live a decent life.
Yeah.
Well, we expect doctors to live a decent life.
Yeah, they have a
But,
family too.
That's right. They have children, etc., a decent life. But jokingly, well, there are even who say that don't go to a doctor who is building a house.
Building a house.
That's why it's very important to really ask at the onset, what
Yes.
is the fee of the
Yeah, yeah.
doctor?
Yeah.
Because it's only
Yes.
fair to,
That's
right.
to
Yeah, yes,
know
that's right.
beforehand.
Yes, they must be able, because they're professional. They must be able to live decent life at the level of their profession and the way they are being seen by the society and the nobility of their profession. They must be able to live that kind of level.
That's
We
why-
don't like to see a doctor who is, looks like that he just come from a farm or from a.
That's why even our society sets certain standards in
Right.
terms of our professional fee.
I see.
But the older ones, sometimes they just want to be selective in their patients,
Yes.
and they purposely
Yeah.
charge a high rate. So
Yeah.
it's up to you if
Yeah,
you can afford it or not.
Actually, that is a patient-doctor relationship thing. And so if you feel like, even if it's high, you want that surgeon to be your surgeon, then go ahead.
Yes.
It's a personal decision of
Yeah,
the patient.
and even
Well,
this.
actually, just as the patients can choose their
Yeah.
doctors, the doctors can also actually choose their patients.
That's
as
right.
well.
That's right. That's right.
That is very ethically.
That's
well,
acceptable.
Yes,
Yeah,
acceptable.
yeah, that's acceptable.
Ang masama is that if you pretend to afford the doctor and you did not, and you could not pay eventually.
But one of the things probably that we have to remember is, well, doctors, they're holding noble profession, should never drive away a person who cannot pay.
Who is
Yeah,
really,
that's
and
true.
it's an
That's
emergency
Because, well,
especially.
while the grocery man may not always give
That's true.
there's grocery items freely, or a manufacturer of a car cannot just give cars freely, but a doctor should never turn
Turn
down.
away
a
That's
patient.
why,
patient.
that's
Because
why,
that is where the nobility of the profession comes in.
that's why they do medical missions.
right.
And,
And it is very noble on their part to do those things. And we are very happy that there are doctors who are doing those things.
Yes. Oh, by the way, before I forget, no, there is such a thing as a thyroid crisis, and I think that is a life-saving procedure or an
Yes,
emergency.
yes, yes.
Can you explain more
Well,
about this?
thyroid crisis, and then there's too much production of the hormone, and it can happen during surgery, particularly if the patient is hyperthyroid. That's why we don't normally operate on hyperthyroid patients.
You lower them down,
Yes,
stabilize
you
them.
control first the levels of the hormones before you operate. And normally we do this together with the endocrinologist to help us in terms of stabilizing the patient.
So that is the risk that can happen
Oh,
during
yes.
the operation.
Particularly if it's hyperthyroid.
And is there a danger of death in that case?
Yes, there can be death. Yeah. That's why we don't normally operate on this unless they are cleared by endocrinologist.
I see.
Let me go back to an earlier point in our discussion where you mentioned something about cutting the nerve. Okay,
yes.
so if you
Accidentally
inadvertently,
cutting,
Yeah.
yes, if you
Accidentally.
inadvertently cut the nerve,
Yeah.
is there anything that can be done to
Yes, okay.
repair or reduce the damage?
If the surgeon inadvertently cut it and knows that he cut it, then he can repair it immediately.
Oh,
It can
good.
be repaired,
Yes, it can
right?
be repaired immediately.
You just tie the knot.
No, it's well, if I say that, it looks simple, but
So,
of course
yeah,
you have
it's
to
not,
have a
yeah.
microscope, have special a thread, to connect it.
Okay.
And there's a small, the area, the perineurium, which you will connect, and not anything else. So if it's successful, then the voice is back in 3 to 6 months. Now, if the surgeon didn't know that he cut it, so after surgery, when the patient wakes up, then the patient is hoarse, then that's a problem. But there are some surgical techniques that can be done to improve on the voice of the patient. In fact, there are some injections which we can do to improve the voice. The ones that they use for fillers in the face, we also use that there.
Botox?
So no, not Botox,
Not
but
Botox.
these are polyurethane things, brand Restylane.
Ah,
Okay, and so if the voice, because the hoarseness is because the vocal cords cannot oppose.
Yes.
So because this is paralyzed, so there's an opening, so the voice now is hoarse. So what you do is you put this, anyway, the other one is moving, you put this midline, and when they're able to oppose, then the voice is back.
That's why the hoarseness, I think, is also typical for the aging population. Is that correct? Is it because of that weakness in the vocal cords, the opposition?
Oh yeah,
or
I think
apposition?
that's a different
Yes.
story, yes. But yeah, the muscles now tend to be a little bit more weak. Yeah,
As
that's
you
why
grow older.
there's a change in voice. It's more a
I
change in voice. Yeah.
How about gadgets, Doc? Well, I heard somebody who is a friend of mine who would talk to me in a very monotonous voice, but probably he's using something. It's like, let's say, this is Dr. Mondeo, it's just like that. No going up, no going down.
Baka
What is
kailangan
that?
one pitch.
voice
Okay.
culture siya.
Well,
Because he was operated on the throat.
the
Probably,
laryngeal
yes.
voice box.
Right.
Okay, so yeah, well, this is a different one, but if you have you're laryngectomized, so you have a permanent hole here, you can use a gadget which we call the laryngeal voice box. Of course, it's monotone, but they're
Right.
developing now a dual tone. They're developing later on probably multiple tones, so the voice will be
Okay,
better.
that's good.
Maganda yung monotone kasi pag nagagalit ka, hindi halata.
They talk
Diba?
like they
Oh, they
talk
say-
like robots. Yeah.
Right.
I see.
But they are,
so
they
may
can be
both
understood
Yeah,
very
they can be
well.
understood.
Ah,
They
I
can be
see.
understood.
So that the one you're referring to has really
Right,
an
right.
opening
In
there.
fact, he's a priest. But he does
I
not say Mass only privately, because when he says Mass, it's, oh, Lord, we were here, also we're it's always like that.
That's part of it.
Going back to that, let's say the surgeon, yes, makes the mistake of cutting the nerve, then after surgery discovers it, and then he tells the patient, well, we have to put those injections in.
Yeah.
What about the cost of that? Shouldn't that be the doctor's?
Yeah, a little bit expensive. Yeah.
Usapan na nila
the
yan.
injection, yes.
What does a
one vial will
cost?
cost 10,000.
Yes, so
Oh,
shouldn't,
and how long will
shouldn't
that
the
be?
doctor shoulder the cost of that?
It depends. If the patient consented to the risk that there are really complications
Yeah, that's a
and
good
it
question,
cannot
yeah.
be avoided, I
Yeah,
think
as long
no
as
fault on the
they
part
know
of
the
the
risk.
doctor.
Well,
Oo.
normally, but normally
But of course.
the doctor normally would tend to lessen the professional fee.
Right.
yeah,
Usually
of
that's the
course.
case. And in fact, I have already known because I also work in a hospital, and what the doctors would do is, well, lessen the professional fee, but at the same time also, well, being a doctor, he must have the art of communication. No?
Yeah.
Sometimes, while medicine is a science, it's also an art.
Oh
Yes,
of
absolutely.
course,
It's
yes.
also an art. That's why even communication is a part of medical practice. So it depends upon on how they have talked about before, and we must always remember also that things can or maybe bots or there may be some accident even in the best of hands.
Oh yes.
Yeah, even in the best, we have to
And-
accept this.
Yeah, and
Every
no-
patient should know this already.
Yes.
No one is perfect, no. Everything.
In fact, whenever we have congresses or conferences, when a surgeon says, "I don't have any complication," you don't believe him.
Yeah.
Right.
You know,
Okay.
it's either
It's
he only has one
unavoidable.
case,
Right.
or he's telling a
Which is
lie.
you.
Right,
Oh,
right.
oh,
Because,
but he has
The more you do cases,
Mm.
the risk is always there, even in the best of hands.
Yeah.
So you have to explain that to the patient.
Of course, if you have only one case and then nagkaroon pa ng komplikasyon, siguro it's time to
100%.
shift to another career already. Maybe medicine doesn't like him.
Okay, let me push the case further. If the patient insists on a second operation to repair the cut nerve, can the patient do
Can
that?
it still be done?
Yes.
How
And it
long?
can be
What is
done.
the ideal time between the first and the
Immediately.
second?
Oh, it has to be
sooner it's done.
immediately.
If it's nerve repair, the sooner it's done, the better.
So the basis would be the hoarseness. You find the person has hoarseness.
Now, if the surgeon thinks that really, you don't know if it was cut or not, you're not sure and everything, and you will not know where to look for it, then the best thing is really the injections. And of course, the other one is what we call medialization. So medialization,
Which
that's
is,
another approach where we put a slab of silicone implant into the medial portion of the vocal fold, and then you push it midline. So that's what you call medialization.
Visualization.
The important thing is it should be really
There are
repaired.
approaches, so many different approaches to improve the voice of the patient.
I see. Okay.
But of course, again, I would like to reiterate to the public that this complication is not very high. Okay, in our hospital, we did research on this, and it's less than 5%.
Less than 5%.
It's less than 5%. The 10% I was telling you about is a general,
Yes.
but in our department, it's less than 5%. Very
see.
low complication rate.
So there's really nothing to worry about.
No,
for
yes,
this.
but it can happen every so often.
Because, well, anyway, doctors are not assurers or guarantors of
Yes.
good results, no?
Yes.
Because in the
Doc-
first place,
doctors
the
are not
patient,
guns.
yes,
Right. They're
in the
humans
first
also.
place, that's why the patient came, because he's a patient,
Yes,
you know? There's something wrong with him.
Okay, we've reached the end of our show, so I guess it's time for parting words from each of us. Attorney Sara?
For those of you watching Medical Dilemma and you'd like to get in touch with our expert today or all of the experts, any of the experts we featured in the past, please email us at heavenlycrestproductions@gmail.com. Thank you.
Okay, thank you, Attorney. Okay, Dr. Panteos.
Yes, thyroid disease, particularly thyroid tumors, are rather common here in the Philippines. And so it's important that patients, if you feel a lump there or somebody tells you, just, your neck is a little bit enlarged, better have a consult. It may just be benign, good, but it could also be something serious. So it's nice for you to have a check.
Okay, thank you so much, Doctor. Father Jerry?
Well, to those of us, all of the population, you should always go to your doctor, your favorite doctors, in case you have some diseases or suspects about diseases, or even if you're healthy, it's always good to go to the doctor.
Okay, thank you so much, Father. Dr. Tess?
My advice to the public is, especially when you are working and you feel that you are very lethargic, or or the other way around, you're
So you
too
can have
hyper.
active,
Yeah,
hyper.
hyper.
Please consult a thyroid specialist, because that might be the root cause of your condition.
Okay, thank you so much, Doctora. I suppose it's safe to conclude that an energetic and active lifestyle can be enjoyed largely if one's thyroid is healthy. So take good care of it. Thank you for watching Medical Dilemma. Watch us again next Sunday, 6 p.m. here on GNN. You can also catch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have an enlightened week ahead of you. Thank you so much, Doctor.
Medical Dilemma.